Okay, so I think we're going to shift gears a little bit. I'm going to talk about something that's certainly interesting, I think, for everybody who's taking care of soccer players, because I think we all deal with injuries chronically or acutely, and I think we run across cold therapy in some sort of shape along our way. Football, as you all know, is certainly a very high injury risk sport, and the injury rates that have been published are, at least in the professional area, about 1 to 2 injuries per player per season, with significant associated times away from competition, which can make quite a significant difference for the team. If you look at the studies from different leagues at the professional level, you can see that both in the British leagues, the UEFA Champions League, and the US MLS, Bundesliga, comparable, very high rates if you look at the numbers, and even higher at the World Cup at European Championships. So this is really something that everybody's facing, that soccer is a risk factor for injury and also a risk factor for long-term problems such as osteoarthritis, particularly in the elite player with an odds ratio of up to 12 to develop osteoarthritis. And it's pretty significant, and we just saw a very good presentation by Dr. Guillen on the issue of soccer players retiring because of degenerative changes in their knees, and that's a study by Draw confirmed that. So the most frequent injuries in soccer players and in general are muscle injuries, ankle sprains, knee injuries that involve the meniscus or articular cartilage surfaces, groin injuries, and ACL injuries, and those are usually either soft tissue injuries or joint injuries. So what happens if we have a soft tissue trauma? Usually there is a contusion or there's a strain, but usually there's associated bleeding, there's some interstitial edema, you develop inflammation, some associated microcirculatory changes, as well as metabolic changes in there. And usually what happens is there's a secondary injury that happens where you have an activation of the inflammation, you have the neutrophil release of aggressive enzymes that lead to a secondary injury in the trauma area. Similar situation if we talk about joint injury. You have, most of the time, if you have a significant injury, you will find some hemarthrosis. There is or some activation of the synovium with resultant inflammation, fluid buildup in the joint. Again, involvement of proteolytic enzymes that can cause, for example, cartilage breakdown and apoptosis, but also can lead to persistent fluid buildup in the joint and associated inhibition of the quadriceps, which is protective of the joint. So as we all know, the standard therapy we're all familiar with is the RICE therapy, is rest, ice, compression, and elevation. But if you look at that, ice and cold, there's actually been quite an evolution in that kind of treatment over the years. Well, remember starting off with just applying ice locally, but this has evolved to add compression, and the newest technique or advancement in this area I'd like to talk about more in detail is the intermittent cold compression. So what does cold therapy by itself do? The classical, just applying ice to the injured area, reduces the joint tissue temperature, reduces the blood flow to the area, either in a local and acute or chronic application. That results in a reduction of the edema, has, again, effect on the synovial activation, as well as the inflammatory process in the injured area, and can have significant effects also on the cellular metabolism in the injured area. That can minimize the secondary effects in the joint, on the cartilage, and the muscle, for example, on the muscle injury or muscle resorption itself, and also often on the reflex inhibition of the musculature as a result. Cold therapy has been shown to be effective and can facilitate rehabilitation. It can reduce pain. We all know that very effectively. We apply ice spray on the field often, but also it can decrease the changes in the range of motion resulting from the trauma, and can help with muscle activation by reducing the reflex inhibition of the quadriceps. Importantly, though, there are significant limitations of cold therapy alone. It's not really controlled. You have no knowledge of how much cooling you're actually applying to the affected area. There's a limited skin contact, as you can see in the picture on the side. The depth is, you have no information about how much you're actually reaching in terms of deeper tissues. It's a very topical effect, and if you particularly deal with postoperative patients, you know that there can be some leakage, and you really do not want to have a wet dressing over your operative wound. So cold compression is the next step, where you apply the additional compression to the cold and the ice itself. And what that does, it actually increases the tissue pressure and increases the skin contact, as well as the depth. That leads to a reduction of either the fluid and edema accumulation within the injured soft tissue, or hematoma buildup in the joint. The compression is very important because it limits the fluid loss from the capillary and can be preventative in terms of edema formation, rather than just reducing it afterwards. There are some effects also on the blood flow. You want to keep blood flow away initially because it has a warming effect and a negative metabolic effect. And again, through the very acute and active application of cold compression, you can reduce inflammation and also facilitate muscle recovery. There have been several studies that have shown that the cold compression is significantly more effective than cold alone. It has a deeper and faster effect, which is, again, very important for acute injuries, as you see in the picture on the side. And there's been multiple prospective randomized studies which have shown that it decreases pain scores, as well as improves range of motion, knee function scores, and importantly, gets your players back to sport and play faster. With a cold compression, however, there's also some downsides, and the application allows only for a single and static continuous compression and cooling effect, which has a potential risk for overcooling, and that's something you have to monitor and be careful about, because there's some significant potential complications, such as frostbite, which doesn't happen often, but there's some degrees, as you can see in the bottom picture here. It can be just in a local area, but it can be quite extensive. Usually happens in areas where you apply pressure and there's only a small soft tissue layer over the bone, like in the patella around the knee, and that can again cause various degrees of frostbite, and in the US has led to significant lawsuits besides the injury to the patient. So the next step in the newest technology is the intermittent cold compression. This is a technology that actually comes from space technology. The NASA used to use a spacesuit for their astronauts that had a system in it that had a circulating cold air on top of a very heat exchange capable material that they were wrapped in. And that was the way of keeping the astronauts cool as they were moving around in space. This has been transferred to the application for the athlete by switching the air to water. The circulating water, as you can see in the picture on the right side, is following the same principle. And there's an adjustable flow rate, volume rate, and as well as compression levels. And a big advantage of this technology is that it provides an insulating effect, but also a very uniform cooling and compressive effect that, in addition to the intermittent compression, has a pumping effect, and I'll show you that has significant functional implications. So the intermittent cold compression in the Game Ready system has all the effects that you have with the cold compression, but it does provide a more homogeneous cooling effect in a larger area. I can show you some infrared images of that in a second. Very importantly, the intermittent compression seems to have a very positive effect on reducing the edema formation by mimicking muscle activity and lymphatic drainage, which doesn't only affect the fluid itself, but also is an effective way of transporting some of the breakdown products and metabolites from the injured area, facilitating the healing process. Another very beneficial effect is on the microcirculation and the arteriovenous pressure. By the compression, it acts very positively on the nutrient flow, the oxygen inflow into the microcirculation, which facilitates recovery, keeps some of the cells that are marginally damaged alive, so that you can minimize the overall secondary injury we talked about earlier. And here are the infrared images, and you can compare the Game Ready system on the left side. See a much more homogeneous, much more extensive circumferential cooling effect that is, again, not in a larger area only, but also cooler, and is maintained also over a significant amount of time. There's also some scientific support that there's not only a cooling effect and doesn't only have a metabolic effect, that this actually really makes significant difference in terms of tissue healing. There have been studies showing that the intermittent compression has an effect on both soft tissue healing as well as bony healing, with improved healing times for fracture healing, for example. This seems to be an effect related to improved vascularity, improved angiogenesis. There seems to be a compressive effect on the endothelial cells that produce nitric oxide, which improves the overall blood flow to the injured area. Seems to be a reduced influence of reperfusion, which is very important also for the edema formation and cell death in the area of the injury. But also collagen organization, fibroblast proliferation seems to be stimulated by this technique. And several studies have shown, both clinical and scientific studies have shown, that that leads to a better quality of the repair tissue, as well as a faster recovery of the functional parameters that are important for the athlete to get back to sports, and an associated accelerated return to sport. There's also a discussed and a potential fibrinolytic effect of the cold in combination with the intermittent compression, similar to what you might see in your DVT prophylaxis after your joint replacements. But this is something that's still being investigated at this point. So I'd like to just really talk quick about the system. The Game Ready system is the only system that provides this at this point. It's an individualized setting, which is very unique and very helpful to adjust it really to the needs and the comfort level of each patient. You have a 30-minute on and off cycle, and you can have a consistent pressure monitoring, so what you set as a pressure will be maintained for those 30 minutes. If it's too much, you can dial it down. If it's too low, you can dial it up, depending on what you want to achieve. Very helpful is also that they have an anatomic shape. You can see the different areas here for the groin injuries, knee, ankle, which provide optimal skin contact and distribution of the cold throughout the joints. There's overall what patients tell me, very homogeneous cooling effect, much more homogeneous than what you would see with the cold compression or just the ice pack itself. It's very well tolerated by patients, and also has the big advantage if you work with a team, that you can actually take it with you. You can be on your team bus driving back from your game. You can put this on and use it. And post-operatively, it's a big advantage is that it actually doesn't leak. So just want to go to two cases real quick. One of our U.S. national team players who had an ACL injury, being 33. He had the Game Ready applied immediately after the injury because we wanted to limit the amount of swelling and edema that he gets, so we can get him to surgery sooner. He had surgery after 10 days. He had a bone-to-bone autograft, and you can see the picture on the right side demonstrates 10 days post-operatively his situation. He had no effusion by 5 weeks, returned to running by 2.5 months, and played again after 5 months. Another case, another professional player from the U.S. Demonstrates quadriceps contusion, immediate application of the intermittent compression, reduction of the swelling, and you can see there was quite significant swelling up here with intermittent and interstitial fluid accumulation, complete recovery after 3 weeks of the muscle, and return to play after 6 weeks. So what we can see, the indications are both for acute injuries, chronic injuries, very important post-operatively, as well as potentially also for injury prevention for chronic inflammatory problems like tendonitis and associated pathology. There are some contraindications that you need to know about, particularly a history of deep vein thrombosis, significant peripheral vascular disease, or problems with diabetic neuropathy are indicators that you should not use this. So overall, we can say that intermittent cooled compression provides a colder, deeper, faster, and longer cooling effect. Because of this, aggressive use can lead to a faster and better healing of the tissue. And in my experience, that leads to a shorter recovery. And with the ACL, for example, on average, I would say it cuts about a month off. So overall, I think because of its facilitative effect and improvement of return to play, that's something I would encourage everybody to take a look at, because you can definitely use that in any athlete at any level. Thank you very much.